I've been in love with the same girl for 55 years, been married 51 of those years. Yes, I had a stroke and my whole right side was paralyzed.
Well, when I came home from Vietnam, I was suddenly impacted by the idea that I had no home. And now I'm an elder in America. I came here in pretty bad shape.
I let him pull out 11 teeth. Years, just went years unattended. Financially, it was just impossible to do anything with it.
This year, the Gary and Mary West Foundation is celebrating its 10-year anniversary. And in the past decade, the foundation is so proud to have deployed 400 grants totaling more than $175 million. And that is just the beginning. Gary came to my office and said, "I have an idea. I'd like to create an organization that's focused on lowering the cost of healthcare, where we can truly transform healthcare delivery for seniors so they may successfully age in place with dignity and independence."
We have to figure out ways to allow our healthcare system to serve more people more cost effectively than it's doing now.
And as we progressed with our applied aging research, we realized we wanted to effect change quickly. And that is why we created the West Health Policy Center in Washington, D.C. to drive meaningful change to help seniors successfully age. I'm very proud of the achievements, which include no less than 20 active applied medical research projects with premier institutes across the country. We've also started to implement protocols for enhanced geriatric emergency care at the new Gary and Mary West Emergency Department at UC San Diego Health, which is truly the first of its kind in California. It's just one of the models that we are creating with the intention of replicating nationwide.
I've always loved seniors. And I've loved spending time with them and hearing their stories. And so I told Gary if we ever have an opportunity to help poor seniors, I wanted to do that.
Gary, Mary, Shelley, and I went to see Paul's operation because we heard that he was doing some really special work with seniors. And we all looked at this and said, wow, we can help. And Gary was the one who said, okay, let's go find a facility. Worked very closely with Paul. So that's what we did.
Up next, the incredible donation that will change lives.
To turn this building at 4th and Beach into this, the Gary and Mary West Senior Wellness Center.
We had 30 people come up afterwards who said, "Gary, this is literally going to change our life." And we are so happy and so appreciative, and that's worth more than money.
Prior to the Senior Center, they really had done everything anonymously. But the Senior Center really opened it up and kind of told the world, here they are, and they're putting their money where their mouth is, and they're going to make a difference.
What makes this place unique is bringing together the social work with the nursing, with the activities, with the meals, with the exercise programs, all of that in one place. That doesn't exist anywhere. I mean, we've looked high and low in this country. There are senior centers out there, but they're not pulled together and looking at the whole person like we're doing here.
The first thing I think I noticed was there was a sense of warmth. I got a sense of hope that I've never had before.
There are about 105,000 foundations in the United States. Of those, only 6 are focused on seniors, one of the fastest growing demographics in our country. And to this end, we're exploring new community-based models that will provide seniors with the care that is most appropriate for them.
I've been coming here for 17 years, but now I can do anything almost, you know. And when I came here, I was a complete dud, but after a while I came out to be a complete stud. And with the physical therapy, and everything started coming back.
The Challenge Center provides physical therapy after people's insurance runs out, and we also have a gym and specially trained trainers to help people with disabilities and seniors work out and stay fit, stay out of the hospital, stay healthy. If not for the Gary Mary West Foundation, we couldn't provide as many hours of service to the seniors that we do. We've been able to expand programs. We wouldn't have been able to do the outcome studies that we're using to demonstrate that we do what we say we do, and we make changes in people's lives. And we save the healthcare system a tremendous amount of money every year.
That day, Mary West was here. We were talking to a senior who had to talk to us with her hand covering her mouth. All she had for chewing her food was 2 teeth, one on the top, one on the bottom. And when we finished talking and she left, so she says, Karen, we have to do something about it. And I said, Mary, we have to do more than just education. We're gonna have to create something. And she says, let's figure out what we can do. And that's how it all started.
The new set of dentures that they gave me, it's incredible. To think that, that these people are taking time out of their lives to help you. And it's just great.
This has been a particularly exciting year because the Foundation has really banded together with the Institute and the Policy Center under the singular mission of successful aging. So I've been able to learn a little bit about the personal journeys of the seniors that we impact, and the stories are amazing, and they're profound, and they're stories of resilience, and they're stories of hope.
Happy 10th anniversary to the Gary Mary West Foundation.
Thank you for what you do.
We truly appreciate the Gary and Mary West Foundation.
You can only express thank you so much.
Gary and Mary, thank you so much.
Thank you, Gary and Mary.
From the bottom of my heart, thank you.
Thank you, Gary and Mary.
We have a wonderful group of employees and volunteers who share Mary's and my love of and commitment to our poor seniors. We are proud, very proud, that they will carry on our work long after we are gone. It is you people who make everything we do on behalf of our seniors possible. From the bottom of our hearts, Mary and I thank all of you.